So once all testing is complete and the patient has an accurate diagnosis, they'll work with their doctor then on a treatment approach. And you've touched on this a little bit, but what are the types of treatment available for people with myelofibrosis?
Yeah, thanks, Catherine. We'll keep it general and standard of care. And as you mentioned at the top, I'll reiterate, none of these are intended to be specific instructions for specific folks, but in general, for the category of patients with myelofibrosis, in general, there's not many treatments, unfortunately. As of 2024, we have only 4 standard JAK inhibitors. So that's this pathway we're talking about, JAK-STAT. Interestingly, you don't have to be JAK2 V617F mutated. These are for the whole pathway, so all patients with myelofibrosis, intermediate to high risk. The first one, Catherine, is ruxolitinib, which has been around for more than a decade, first-in-class JAK inhibitor. The second drug is fedratinib. The third is pacritinib, approved only in 2020 for those patients less than platelets of 50. And then the myelofibrosis drug, momelotinib, just approved not even a year ago, September of 2023, for myelofibrosis with anemia. So those 4 consider as called JAK inhibitors. They are really the only targeted therapy class of drugs specifically approved in the MF space. Outside of that, there's older and other drugs that we and others have used, if you will, so-called off-label or historical use, hydroxyurea, interferon products such as pegylated interferon, hypomethylators such as azacitidine and decitabine, particularly in more advanced cases. Some of those drugs are borrowed from MDS, AML, and have been around for decades. And then, of course, finally, clinical trials. We really recommend folks, if they have the ability and feasibility, clinical trials, even in the first diagnosis setting, so untreated first therapy. These clinical trials, Catherine, are based on 3 factors. One is JAK inhibitor plus another agent. So that's kind of like a combination trial. 2 is add-on agents. So you already on the JAK inhibitor for a while, maybe starting to not work, then you add in a third agent. And then 3 is completely novel agent beyond the JAK-STAT pathway. And then maybe we can even add a 4th one now as this is evolving in real time, which is anemia targeting drugs. Many of our patients have either transfusion dependent or really bad anemia. And some of the drugs that are being developed are specifically aimed at that.